want you to imagine a commercial. Screen starts black, and there's foreboding music playing. Then the first scene, you have an adolescent boy, he's lying in bed, he's angry, he's frustrated, there's tears in his eyes. He's staring down at his hand. And in his hand, he's holding his father's 9mm handgun. Now imagine a father walking in, and maybe they have some angry words and shout, but then the father sits down, starts talking to him. Music brightens up a little bit. Then in the next scene, we see the boy in a counselor's office. He looks engaged, he looks hopeful, he looks optimistic. The music hits a bright crescendo, and the final graphic says, "Counseling, it really works." Now, you don't see commercials for counseling, not because it doesn't work, but because it's not created by a multi-billion-dollar industry that puts more money into marketing than it does into research. You do see commercial after commercial for psychotropic medications that don't work that well because they are made by multi-billion-dollar corporations that put more money into marketing than they do into research. This discrepancy is about money and power. It's not about what works. Now, before I go further, I just want to give you a quick disclaimer and offer a challenge. The disclaimer is I am in no way affiliated with the Church of Scientology, which is known to be highly critical of mental health interventions. I'm a big supporter of interventions that have evidence behind them. Second, I love a debate. What I'm going to say follows the evidence, but it might clash with some beliefs you have about mental health. So, if you want to continue this, contact me directly at Cleveland State University. I'll provide an auditorium, a public format like this. You bring your evidence, and I'll provide the coffee and cookies. Now, if you're not up for that, you can always contact me at my blog at elliottIngersol.net. Now, I'm giving this talk today because I've been shaken to the core by the violence in our society, and most recently by the massacre at Sandy Hook Elementary School. The gunning down of teachers and students in their classrooms can only be described as evil. Our response to this evil has been a national dialogue about gun violence, media violence, and about mental health. But where mental health is concerned, there's a problem. The public doesn't know what mental health professionals like me do know. And more importantly, the public doesn't know what mental health professionals like me don't know. We need to close that gap so we can have a dialogue about what works and what doesn't. Now, since 1992, there have been 387 school shootings with almost 500 people killed. And we have to remember that 2/3 of gun deaths in our countries are suicide. And we're losing too many veterans that way. These are all mental health issues. As far as the school shooters were concerned, we know some of them got mental health treatment, but what we're learning is a majority of them were taking psychotropic medications when they committed the acts of violence. Now, we can't confuse correlation with causation. Just because someone was taking a psychotropic medication when they committed an act of violence in no way means the medication caused the violence. Most people know that. What most people don't know is if someone's taking a psychotropic medication, especially a child or an adolescent, we have no clue if anything therapeutic is happening. They might just be getting a chemically instilled sense of apathy, which could be as dangerous as it is therapeutic. And this results in ambiguity. And in mental health, where there's ambiguity, a lot of times we fill in the gaps with what I call word magic. Word magic is using words to create an illusion of certainty where, in fact, there is no certainty. As a clinical counselor and as a psychologist, I've spent decades researching psychotropic medications, psychiatric diagnoses, and the word magic that confuses the public in both of these areas. But let me give you an example of word magic. Mental illness is caused by a chemical imbalance in your brain. Now, most of you have heard this. Some of you may believe it, but you might be surprised to find we don't have any evidence to support that assertion. Those of you familiar with research databases like Medline may be surprised to know that if you enter chemical imbalance in as a search term, you get about 18 unrelated papers, none of which supports the hypothesis that mental illness is caused by a chemical imbalance in the brain. This is a misnomer, but it's a misnomer that has been capitalized on by the pharmaceutical companies. But it's a belief, it's not a fact. You will hear this in commercials, like commercials for antidepressants. The narrator will say, Some people believe depression is caused by a chemical imbalance in the brain. They have to say belief because there's no evidence. It requires faith. I'd love to see a commercial where the narrator says, some people believe that depression is caused by extraterrestrials in the 8th dimension disrupting the electrical circuitry of our brains. Thank you. I'd love to see that commercial, but it probably wouldn't sell a lot of pills. Word magic has to be carefully crafted to evoke a sense of emotional uncertainty that will then be dispelled temporarily with the words. Now, some companies will say, but wait a minute, we have studies that show efficacy of these medications with children, adolescents, and adults. Unfortunately, investigative reports are finding more and more that many times the company that makes and sells the medication is the company that's doing the research. And we have reports that sometimes they will get results that they don't like and they'll just sit on those. Then they'll redesign the methodology to increase the probability to get results they do like. And then, if they get them, to add insult to injury, they'll approach a well-known psychiatrist and pay that person to put their name on that report and submit it to a medical journal. Now, where I work at Cleveland State, we call that academic fraud. I don't know what it's called in psychiatry, but it is unethical. Now, do all psychiatrists do this? No, they don't. But until the ones who do are willing to police themselves, I would suggest we need laws to make what is unethical illegal. Now, speaking of legalities, you may not know, the idea of advertising medication directly to consumers was illegal until the mid-1980s. We call it direct-to-consumer advertising. In the mid-1980s, the ban was lifted, and the most advertised medications saw skyrocketing sales. Commercials work, PR works. But I would suggest we need to renew the ban on direct-to-consumer advertising because far from creating education about medication, which is what the drug companies claim, these ads are perpetuating the very word magic people like me are trying to dispel. Let me give you another example of word magic, a little variation. Psychotropic medication corrects a chemical imbalance in your brain. Now, the brain's the most complex thing we know of. And right now, we have no idea what balanced brain chemistry would look like. So we can't say what unbalanced brain chemistry is. We do know you can intervene chemically, and some but not all clients will have improvement. That in no way means the chemicals affected by the intervention were somehow unbalanced to begin with, any more than if you smoke a joint and feel better, it means you have a cannabinoid imbalance. The logic doesn't follow. But it's this kind of illogic that sells a lot of medications, and this is why more and more Americans, and especially children, are being placed on psychotropic medications they have no business being on. It's even worse if you're a child in foster care. Then you have an 8 times greater chance of being placed on not just 1, but 2 or 3 psychotropic medications. And this is before anyone tries talk therapy, which we know to be effective. Many of these children are traumatized and they act out, and we're medicating the symptom, but we're not getting to the root. Now, an excellent resource I would recommend to you is Dr. David Cohen's Critical Think RX. Dr. Cohen's put a website together to go over the psychosocial interventions that do work for children and has explained in many cases why psychotropic medications don't. Now, let me talk a little bit about mental disorders. The murderer at Sandy Hook was said to suffer from a mental disorder. This doesn't really tell us anything. It just tells us he was diagnosed with a disorder from the American Psychiatric Association's Diagnostic and Statistical Manual, which we call DSM. Now, the majority of disorders in DSM are normed on adults. And in most cases, the criteria do not generalize to children. Bipolar One Disorder is a really good example. Bipolar One Disorder is a very disabling condition where a person suffers from mood swings so severe they range from major depression at one end of the spectrum all the way to mania at the other end. Early onset for Bipolar One Disorder is considered age 13, and it's considered rare. But tens of thousands of children as young as 2 years old are being given the diagnosis, even though no one can tell me what a manic toddler would look like. Right? They're all a little manic. The logic doesn't follow. Now, this talk is taking place about 2 months before the American Psychiatric Association releases their next version of the diagnostic manual, DSM-5. It was hoped by DSM-5, we would have biological markers that were correlated with these disorders, particularly serious ones like Bipolar One Disorder. That way, a doctor could test for it like they might test for Streptococcus bacteria if they suspect strep throat. Unfortunately, as the editors of the research agenda for DSM-5 have written, psychiatry has utterly failed to find even one biological marker for one disorder, placing psychiatry 50 to 100 years behind every other branch of medicine. Now, if your general practitioner was 50 to 100 years behind in their practice of medicine, they might not even know influenza was caused by a virus. My point is, mental disorders are not like disorders in other branches of medicine. We still don't know what causes them. We need more money for basic brain research, and we need money to look into genetic contributions, but we don't know what causes them, and this creates a lot of ambiguity. And Americans hate ambiguity. We want snazzy solutions, rapid responses, quick fixes. But let me level with you, where mental disorders are concerned, we don't have quick fixes. We do have effective therapies, though. So let me do a little mental health 101. What is talk therapy? Well, sometimes it's called counseling, sometimes it's called psychotherapy, sometimes it's called a psychosocial intervention. And there are dozens of approaches to talk therapy. The approach we choose is not as important as the relationship we cultivate with the client. We call relationship a therapeutic factor, and I'm going to come back to that. So who does talk therapy? Well, psychiatrists, psychologists, clinical counselors, school counselors, clinical social workers, school social workers, addictions counselors, marriage and family therapists. There's a lot of people who can provide this service. Now, psychiatrists are medical doctors who graduated from medical school with a specialization in psychiatry. A huge problem, a systemic problem they face is that they graduate with the same student loans as their friends who specialized in oncology, anesthesiology, or plastic surgery. Unlike their friends, they can't charge the same per hour to provide psychotherapy that, say, their friend could charge doing plastic surgery. And I would say we need to address this. Maybe things like loan forgiveness programs for people who want to dedicate themselves to child psychiatry. Otherwise, what you get is what we have. It devolves into what we call the practice of med checks. The doctor sees the patient for about 6 to 10 minutes, and that's the end of the discussion. And then they get trapped in a cycle of seeing 4 to 6 clients like this per hour, and many of them would rather be doing the talk therapy that we know could be effective. Now, these other professionals are what we call non-medical mental health professionals. And basically, they all do talk therapy. Most can diagnose and treat mental and emotional disorders. A huge problem this group has is they're way too busy spending resources fighting each other, talking about how counselors are different from psychologists who are different from social workers. We all draw on the same knowledge base. I would submit we are in crisis mode, and we need to band together, join our resources to stop the over-medicating of America. And we are going to have to, because the pharmaceutical industry has 1,200 lobbyists at the federal level. Groups like the American Counseling Association are lucky to have 5. So this leads me to the question, what is mental health anyway? Well, an academic answer is mental health is the ability and willingness to make our thoughts and feelings objects of awareness and understand how they relate to our lives. And when I say this, my students and my clients usually ask, do you have a less academic definition? So the less academic definition, mental health is the ability and willingness to monitor the crazy stories we tell ourselves in the privacy of our mind and not act on them. Now, I guarantee you, everybody who perpetrated a school shooting or committed suicide with a gun was telling themselves a crazy, destructive story. Maybe we couldn't have stopped all of them, but we could have stopped some of them with talk therapy if we just could have gotten there soon enough. We could turn with talk therapy. You can turn a crazy, destructive story into fertilizer for something that might be nourishing, maybe even beautiful. How do we identify them, though? The best predictor of violence is a history of violence. So how do we get to people before the fact? Well, one way is services across the lifespan. And one of the first places a child can have to explore the stories they're telling themselves in the privacy of their mind is a school counselor's office. School counselors are thoroughly trained in therapeutic interventions, including brief therapy and group skills. School counselors are not a luxury. The recommended ratio of students to school counselors is 250 to 1. In Ohio, I think we're at about 500 to 1, and we need to work on that. There are some federal acts that might help us out, the Student Support Act and the Mental Health in Schools Act. I would suggest if these acts are going to bring money to provide talk therapy for children and adolescents, we should support them. If they're just going to divert money for more psychotropic medication, we should not support them. Now, people also get clinical services in the community. And again, programs like Medicaid pay for those services. And we need to get the Medicaid monies focusing on talk therapy as a first intervention and then medication as a second. Medication can help, but it's never going to be a replacement for talk therapy. We also have to take responsibility for mental health. I said relationship was a key therapeutic factor. We've got to cultivate community. We've got to talk to each other. We've got to have people, real people, to tell our crazy stories to, and people to listen to their crazy stories. We need to talk to people face to face. As the case of the cannibal cop in New York City is demonstrating, it is all too easy to lock yourself into a crazy, destructive story, go on the internet, and find support for that. We also have to take responsibility for mental health by giving up the delusion that we can find mental health in a pill. We cannot find mental health in a pill. We can find it through things like talk therapy. And again, talk therapy can take a crazy, destructive story, turn it into something like fertilizer that could grow something beautiful. Now, if we can make this shift, maybe within a year, you will see that commercial for counseling and how it works, and fewer commercials for psychotropic medications that do not. Thank you very much.